Excellent. All right. Shall we get started? So if you would like to move to the next slide. So I will do an acknowledgement of country. So we acknowledge the Palawa Pakana of Lutruwita, the traditional owners of the land upon which we live and work. We pay respects to elders past and present as the knowledge holders and sharers, and we honour their strong culture and knowledge as vital to the self-determination, well-being and resilience of their communities. We stand for a future that profoundly respects and acknowledges Aboriginal perspectives, culture, language and history. And we also acknowledge all the lands on which everybody is joining today. Next slide. Great. So I'm Michelle. If you haven't met me before, I'm a physiotherapist at the University of Tasmania and have been living with Parkinson's for 3.5 years now. My co-lead of the Tasmania Parkinson's Project is Jane. Do you want to say hello?
Yeah, thank you, Michelle. I'm Jane. I think most of you have met me now, but if you haven't, I'm a doctor, I'm a neurologist, and I work at the local Royal Hobart Hospital, seeing lots of people with Parkinson's. And my other job is working at the university, where I undertake research into Parkinson's.
Great. And our special guest today is Christine. Christine is an optometrist from the University of Melbourne who has extensive experience in research with Parkinson's and vision. Do you want to say hello, Christine, and add anything to that?
Hey everybody, very nice to see you all today and thank you for joining us during your lunchtime. Michelle, I think you pretty much covered most of it. I'm an optometrist and still see patients, and my research area in academia specialises in Parkinson's disease and vision.
Fantastic. And I have been a participant, so I'm very much looking forward to your presentation. Very interesting. So today, if you have any questions, particularly around vision, please put your questions and comments in the Q&A area, and we'll try our best to answer as many of these as we can at the end of the webinar. Next slide. As we always do, just a very quick update on the Tasmania Parkinson's Project. We have 3,800 participants. Please tell your friends and family. We'd love to get up to 5,000, particularly interested if you have Parkinson's, but also if you don't, please join us. We do try and do more than research. We run these webinars every 1 to 2 months on a range of topics. We have newsletters and a number of research projects as well. And I think, Jane, you're going to update us on a couple of those other things as we go along. So next slide. Yes, so anybody can join over the age of 18 with or without Parkinson's, and you can see the website down there to join up. Oh, Jane, that's a bit clever. Okay.
I don't know what's happening. We're just as well as the slides.
Okay. All right. I don't know what you've done there, but I'll get you to.
I don't know why I'm the only one on here as well. Let's go back to that.
Okay. Jane loves playing with special effects and may have gone a little bit too far this time. Are you able to go to the next slide? Yes. Okay. Right. Away you go, Jane.
All right. Well, maybe I will try that because I don't think otherwise you can see anybody. So hopefully you can see me there. So what is coming up on the Tasmanian Parkinson's Project, is an exciting project that you're all part of. Let's have a look. So we've got some monthly webinars, as you know. We've been running these now for just over a year, which is absolutely fantastic. And next month, we've got 2 speakers, actually. We've got Jan Radford, who some of you might know because she is a GP up in the north of Tasmania. And she'll be talking about her perspective, really, of helping people with Parkinson's to live well with Parkinson's. And then we're really delighted to have Michael White, who is a man with Parkinson's, who's been living with Parkinson's for over 20 years, actually. And some of you might have heard him talking when we had our Parkinson's MOOC launch. And there was a big gasp, a big sort of intake of breath when he stood up and said, well, I've had Parkinson's for 20 years. Because Michael looks absolutely fantastic and has got some great, exciting stories to tell about how he sailed around Australia. So please join us next month for that webinar. What else can I tell you? I've mentioned the MOOC and the massive open online course. We are delighted to say that this is going to be reopened at the end of this month. And a few of you have been asking about the date. So we can now say it's going to be the end of October. And this time, rather than just launching it for 3 or 4 months, we're planning to keep it open indefinitely. So just as Michelle said, please tell your family and friends about this. We got 5-star rating from the first launch. We've made a few little changes. There's a few new videos in there. So even if you've done it before, please come back. And yeah, we're really excited about launching that again. Part of the Tasmanian Parkinson's Project is the opportunity to take part in research. You don't have to, but it's always nice. The more, the better, really. And there's different kinds of research that we've got launched at the moment. We sort of change it around, but at the moment we've got TAS tests, which stands for Tasmanian test. And this is a computer test that you can do at home on your laptop or your desktop. And we get you to sort of hold your hands up and it can measure tremor or the speed of tapping. And we're really trying to develop a new test there to help people in the future get a quicker diagnosis, but also for people with Parkinson's to be able to track changes at home. Quickly, we will be asking about 500 people to come into our different centres around Tasmania next year. We're lucky enough to get some funding through the Michael J. Fox Foundation to collect blood from people with Parkinson's, people with what we call atypical Parkinsonism. You might have heard of some of these other things like MSA, PSP, and so on. But we will also be asking people that don't have Parkinson's to give blood. And really what we're trying to do there is better understand the genetics behind Parkinson's. So watch this space. And another thing to watch this space for is an advisory group. Don't know, Michelle, if you want to say anything else about that.
Yeah, just very quickly, we were looking for people to actually join us as part of some of the research teams. We also have PhD students who are studying, and we're looking for research buddies. And if we are going to be organising some new face-to-face seminars, we're looking for people to join us in part of the organising, I guess, committee. So particularly if you have Parkinson's or a care partner, we'll be putting out a call for people to apply. So watch out for that.
So as you can see, we're super collaborative. We're all in this together. It's not like we're the leaders and you're the followers. We really want to work with the community to improve all things Parkinson's. And this is going to be fun. So Michelle and I and one of the PhD students, Celeste, and I think Sam Bramich as well. We're going to be coming to meet you if you're in the north of Tasmania. So there's a couple of dates there for your diary. There's a public lecture that's being advertised all over social media at the moment. So we're going to be talking about Parkinson's again. Bring everybody. And then we'll also be going to the Parkinson's Tasmania support groups. So you might already be a member of one of these. And you can see there, we're going to be going to Launceston and Ulverston. So we're going on a bit of a road trip. Watch this space. Michelle and I are on tour. We're moving from behind the camera out into the community. All right, well, I will stop there. There's a little date for your diary there for the next webinar. I'm going to be handing over to Christine and going back to the normal view of content only. And I will stop sharing there and let Christine tell you all about the visual changes that are happening in Parkinson's. And I've got lots to learn from this. So I'll switch off my camera and be listening avidly to Christine.
Thank you so much, Jane. I'm hoping that you can now see my screen, but do let me know if not.
Yes, we can.
Excellent. And I'm not as tech savvy as Jane to be able to pop my head in front, but hopefully you can still see myself. And if not, that's okay, as long as you can hear me. I can tell you about this wonderful world around eyes and Parkinson's disease. And one of the reasons that I'd like to have a chat to you about it today is because vision can be an overlooked symptom in Parkinson's, because there are changes that also happen as we age, but these changes can be slightly different and more exaggerated in people living with Parkinson's disease. And importantly, there are ways in which we can tailor management for people who also have Parkinson's. And so that will be somewhat the first part of the discussion today. And then for the last part, I'll be speaking to you about some of the research we're doing in collaboration with Jane and Michelle here to try and use the eye as a window into what's happening in Parkinson's disease. So people with Parkinson's disease can experience a range of different symptoms in terms of their eyes, and I'm going to go through some of the key ones today. But if you are experiencing any of these or others, we'd really recommend you go along to your local friendly optometrist and get your eyes tested. And the majority of practices, for some context, tend to fully bulk bill these testing sessions under Medicare, and so there tends to be no charge to yourself. And hopefully you'll be able to find an optometrist no matter where you are, whether you live in the city or rurally or regionally. They'll be located in your local shopping centre or your local high street store. So one of the common symptoms that increases as everybody gets older, but it is more exacerbated if you have Parkinson's disease, is dry eyes. And so dry eyes is, of course, that gritty, irritated, sometimes itchy sensation in the eyes, particularly in this hay fever season we're having in Melbourne at the moment, and it can feel quite annoying on a day-to-day basis. And the reason that it's more prevalent in Parkinson's is because of the reduced frequency of blinking. And so with that reduced frequency of blinking, there's more capacity for evaporation of the tears from the front of the eyes. And so one of the mainstay treatments in dry eye disease is to replace those tears. And that is commonly done with tear supplements or tear replacement drops. And the standard way to pop those in, you can see in that little image there, and it's likely many of you have done this yourselves, is to pop the little dropper bottle about 1 centimetre away from your eyes and squeeze it in. And so you can imagine that this process requires some accuracy and some manual dexterity. And so a tip, if you're finding this difficult, is that you could ask a loved one to pop the drops in for you. Another dry eye hack, if you like, if that's a little bit tricky, is that nowadays there are these sprays that are available where you can hold them a little bit further. You don't have to aim it quite as directed to the eye, and that can be a little bit easier to do. And you can also do that with your eyes closed if that makes things more comfortable. The other key thing about dry eyes is that it is a little bit like watering your garden, in that you want to be proactive and preemptive with the installation of the eye drops. And so like watering your garden, you want to do that quite regularly, and you want to do that before things get too dry and the leaves fall off the trees. And so remembering to do that, perhaps if you take your Parkinson's medications regularly, doing that at the same time can be a good way to keep on top of your dry eye medications. So another everyday task that people with Parkinson's disease may have difficulty with is reading. And this is on top of the standard everybody over the age of 45 years old eventually needs reading glasses, and having good reading glasses will certainly make a big difference for you. But as an additional overlay, people living with Parkinson's disease sometimes find it difficult to track words across a page. And so the reason behind that is because the eye movements required to fixate on a word and then move your eyes to the next word, fixate on that one and move your eyes to the next word, and so on and so forth, can be challenging. And so one of the practical tips to assist with this is you can use a ruler placed on your page, and that can help track the words, or you can move your finger along as your eyes scan across that sentence, and that can be assistive on a day-to-day basis. What is another good tip that can also really help with a lot of the vision-related things is appropriate lighting. And so particularly when you're reading, appropriate lighting, directed lighting provided by a lamp. And that lamp, if you make sure it's not kind of directed at your eyes, which would increase the glare and actually make it more difficult to see, if you pop it kind of behind your shoulder and make it shine onto the document or the book or the text that you're reading, can actually make a big difference. In this day and age, a lot of the things that we read are now digital, and so that also offers the opportunity for you to enlarge your text on your Kindle or your iPad, and that can also make it easier to track words across a page. So vision symptoms, like with many of the Parkinson's symptoms, they can improve with your medications, so appropriate control is helpful as well. So also linked to comfort in reading or looking at things up close, particularly fine detailed things. If you have any hobbies like crochet or knitting, my daughter's age, which is under 10, is actually into crochet and knitting, so it's very much making a comeback. In addition to the blurriness that you might feel in looking at those fine detailed things up close, people who are living with Parkinson's disease also sometimes experience actually a slight doubling of their vision. And that's slightly different because what's causing it is a change in the area of the brain that causes the two eyes to work very well and synchronously together to look at the same thing in the same spot at the same time. And the thought is because that area of the brain that controls those two eyes is close to the area that's affected in Parkinson's disease. And so to treat this, you can see your optometrist or your ophthalmologist or your orthoptist. So basically, any of the eye care professionals that start with an O are the ones that look after your eyes. And what they will do is they will help prescribe special lenses for you that can be incorporated in your glasses that enable the eyes to then point at the same thing at the same time. And that removes that double vision and brings it back to single vision. So that can be incorporated permanently into your glasses, but it can also, if you're finding that double vision is variable, then there's an option to put on that lens, which is called a prism, as a temporary stick-on version in a kind of try before you buy scenario. So speaking of glasses, of course, this is a key method to help improve your vision, and something again which is important for everyone, but particularly for people living with Parkinson's disease, because we know that by correcting your vision with glasses, we can very actively decrease your risk of falls, which we know is more likely to occur when living with Parkinson's disease. So improving vision with glasses is certainly something that's within our control to manage and something worth speaking to your eye care practitioner about. And more specifically, what assists is providing clear vision, but also actually minimizing dramatic change between each new pair of glasses. And so to do this, we'd really recommend getting your eyes checked quite regularly. If things are going well and smoothly, this can be every 1 to 2 years if you're not really noticing any change, just for your general checkup. If you are noticing a change, then do go and see your eye care practitioner sooner. If it's an optometrist, then again, even these interim visits tend to be fully covered under Medicare. An additional tip is, as we get older, we all eventually require cataract surgery. And so choosing to do this slightly sooner rather than later can also assist in minimizing the change before and after cataract surgery. And that can minimize your risk of falling down, which of course has a big impact on quality of life. So the final tip here is to speak to your friendly optometrist and let them know, or your ophthalmologist, that you are living with Parkinson's disease, and describe the kind of daily tasks that you would like to do. And thus they can tailor your eye care needs and treatments appropriately. So the last visual symptom I'd like to talk about today is one which is very common in Parkinson's, but also very underreported. And that may be because of the perceived stigma associated with visual hallucinations. And Jane can very much talk to this as well, in that it's actually quite common for people living with Parkinson's disease at some stage during their Parkinson's journey to experience a sensation of seeing things that they know aren't there. And so on an individual basis, it can look like a wide variety of things. Some people express that they see faces or figures, sometimes shadows or inanimate objects. And it understandably can feel very disconcerting for individuals, but sharing this with someone, including your Parkinson's doctor, like your neurologist, can assist, because it may be an indication that your Parkinson's medications are too high. We also know that, again, improving your lighting in your living and working areas can decrease your risk of hallucinations. And of course, your neurologist can also do some additional tests, as well as reassure you, if appropriate, that it is something that often occurs in people living with Parkinson's disease. So in summary, if you are experiencing any of these symptoms or any others we haven't had a chance to touch upon in terms of your vision, do feel free to go to any of those eye care professionals who can assist. And if you already have a trusted eye care provider, such as an optometrist, an ophthalmologist, a neuro-ophthalmologist, again, all your O's here, that's a great place to start. If you don't as yet, then an optometrist may be a good first port of call, because they're much like the GPs of your eyes, and they will be able to refer appropriately pending what you're experiencing. And of course, to provide a holistic approach to your Parkinson's health care, we also liaise with your GP and neurologist. So with the intersect between vision and Parkinson's disease, the next part of the talk I'd like to speak about is how we're trying to use all of this as a silver lining. And it's what our research is trying to explore, in that we might be able to use what we can pick up in the eye as a means to help people living with Parkinson's disease, as well as future generations who may be at risk. And this is because the eye is this wonderful and unique organ in which it's actually an accessible outpouching of the brain. And so it's the only place in the whole body where we can directly visualize the same types of neurons that occur in the areas of the brain that are affected in Parkinson's disease, and the same types of biology changes that occur in that Parkinson's area in the brain also occur in the eye as well. And the reason that it can act as this outpouching or window to the brain is because we have evolved in a manner where the front part of the eye is completely clear. And so that enables us, of course, to see out into the world. But what it also means is that doctors, optometrists, clinicians, scientists can also use that same clear window to see directly into the eye, and in particular to the retina, which is the part of the eye that's most similar to the brain. And you can see that in this picture here by the orange looking tissue with the blood vessels on it at the back of the eye. And it's very likely that many of you on the call today have already had one of these eye scans done if you've visited your optometrist or ophthalmologist, for example, to get your glasses updated. And this here is the procedure of what taking a retinal image or retinal scan looks like. You pop your chin down on a chin rest in front of a large camera, and what you will experience is a flash of light, much like a photography flash. And these are the types of scans and images that are now commonplace. This one here is a two-dimensional photo of the back of your eye, that retinal region that is similar to your brain neurons. And here, I'm hoping this video works, is again that two-dimensional image of the retina, but what we also get on top of that is a three-dimensional view of the retina as represented by the dark grey and light grey bands here that enable us to see on a microscopic level not only different layers of cells, but different parts of those cells. And so this has really dramatically changed how we assess and how we treat eye disease, but it could also prove quite useful for brain diseases like Parkinson's as well. And so the reason that this is important is because better biological markers, otherwise known as biomarkers, and in our group, we are a little bit nerdy here and we like to call them biomarkers, given that we're vision people. But biological markers are really urgently needed in Parkinson's because we need to be able to measure things properly, as it helps us to track progression. It helps us to monitor treatments, as well as to personalise new medicines to individuals living with Parkinson's disease. For future generations, it may also be a game changer here as well, because of the widespread nature of those eye scanning devices we spoke about. It might assist in picking up Parkinson's earlier, which could prompt lifestyle modifications to decrease the risk of going on to get Parkinson's, as well as progress treatments, particularly novel treatments and new treatments for people living with Parkinson's, as well as those who may be predisposed to it in the future. And so it's quite exciting that we can measure these changes in a rapid, non-invasive and quantifiable manner because of the tools available to measure these things in the eye due to its window-like capacity. And so the work that you see here on your screen at the moment comes from 2 papers that are on the snippets at the top there. And you're welcome to look those up. You can pop them into Google and you'll find them on the internet in case you would like to learn more. But these vision changes include changes to a person's colour vision that actually occurs about 10 years before getting diagnosed with Parkinson's disease. And it's something that people don't often report because it happens very gradually and it's quite subtle and tends not to affect people on a day-to-day basis, but it is something that we can measure with our sophisticated tools. On the other side there, you've got a 3D eye scan, those widespread scans we were talking about before. And in this study, we found that in people living with Parkinson's disease, they had some microscopic changes in the outer part of the retina. And the other study that you see at the top indicates that when you look at all the studies kind of done on this topic around the world, these changes in colour vision and 3D eye scans are quite consistent across the studies. So the other thing that this piece of work looked into was how those outer retinal cells function and how they work. And so we did this a couple of different ways. We did it with a test that is done in the clinic. That's the one where you see the patient covering one eye. And what we did was we popped a little Band-Aid electrode just below the eyelid here. And that enables us to, in effect, listen to how well those cells are working. And it turns out that the outer retinal cells in people living with Parkinson's disease work differently than people without. And if we do that via another assessment, which can be done on an iPad device, and so you can imagine that this could also be done in the comfort of your own home, we also find alterations in how well those cells can work. And so this is quite exciting. And so we're now in the process of expanding on this research to include more sophisticated colour vision tests using computerized colour vision. And our current participants have told us that it feels a little bit like playing a computer game. And we're also incorporating more advanced 3D eye scans, as well as coupling it with some novel approaches that advance the standard 2-dimensional white light camera flash to instead use a rainbow of different colours in an attempt to try and uncamouflage the hidden Parkinson's proteins lying at the back of the retina, which is an expansion of some of our laboratory studies that we've been doing. And so if you are interested in learning more or participating in this face-to-face study that's occurring in Melbourne, in Victoria at the University of Melbourne at the moment, then do feel free to get in touch. And it's very much open to whether you're currently living with Parkinson's disease, if you're a carer, if you just have an interest in getting involved, you can get in contact with us by scanning the QR code that you can see on the screen. You can type in that link or give us a call on the number that you can see. Or alternatively, you can give the talented PhD student who is running this particular study, Jingjing, and you can also see her photographed in the top left-hand corner as the patient here. You can give her an email and we can give you some further information should you be interested at all. And so to finish up, I'd like to emphasise that we very much walk this journey together. And I'd like to sincerely thank Fight Parkinson's, who is our local Victorian advocacy organisation, and all the volunteers who have made the research that you've seen thus far possible. And it seems like there's very many analogies to the Tasmanian Parkinson's Project, in that we very much know that community involvement here is really, really key. And photographed here, you'll see the wonderful team who are continuously trying to advance discoveries in Parkinson's. And today I've very much spoken to you only about the eye-related aspects, but this is part of a much bigger picture. And we're working with the broader team here, including Jane and Michelle and Sam, who you've probably interacted with before, and trying to parallel these eye tests alongside the Tasmanian test as well, and because we very much recognise that a collective approach is what is required to answer these big questions in trying to better detect, to better monitor, and ultimately all of this leads to better treating Parkinson's disease. So I'll finish up there, but to end up, I would like to say that I am very happy to answer any questions that you would have, and allow me to stop sharing my screen so we can see you all.
Thank you so much, Christine. That's so interesting. And I'd really encourage you, if you're in Melbourne, to take the opportunity to participate. It's so interesting, all those tests. And I do remember the colour one being particularly difficult. But I have just a question, actually, before we go to some of the questions in the Q&A. How do you go when someone has quite a severe tremor or dyskinesia? Because I noticed that, you know, you had to put your head there and things and stay, I'm assuming, quite still. And so how do you or an optometrist, when they're doing an assessment, adjust for some of those symptoms of Parkinson's?
Yeah, that's a great question, Michelle. So we're very fortunate in that the advanced technology of the devices actually compensates really well for the movements that an individual experiences. And so that corrects quite appropriately. And so the patient is very free to blink, they can pause, they can rest, we can pop eye drops in, and so it tends to capture the images quite well, despite the movements that can be associated with Parkinson.
Oh, great, thanks. And gosh, can I just take one more?
Absolutely. By the way, I find the colour vision test tricky as well.
Oh, good. You mentioned a neuro optometrist, and so when should someone see a neuro optometrist versus a normal optometrist? How does that work?
Yeah, that's another fabulous question. And so it very much is symptom dependent. And so if you don't currently have an eye care professional, then perhaps the most appropriate approach is to first see a general optometrist, and then they can determine whether you're best to be referred to a general ophthalmologist or a neuro-ophthalmologist who very much specialises in, you know, that connection between eye and brain, and is adept at dealing with the more complicated cases. But yes, going through some kind of referral pathway, either that be through an optometrist, a neurologist, a GP, to determine which one would be the best fit is probably the best way.
Yeah, great, thank you. So we've got a couple of questions. Jane, did you want to read them out, or shall I read out those first
Yeah,
one?
I'm happy to read out. And just to remind everybody, just pop your questions in the Q&A box. Just type them in, and we'll try and get through as many as we can today. We often find that everybody types them in the last 3 minutes, so get in there early if you want an answer. But Christine, I've got a question here, which I think is quite a common one. It's from Andy. And he says, I certainly do have dry, itchy eyes. You mentioned that at the beginning. But at the same time, strangely, his eyes also seem to water copiously. So it's kind of alternating between dry eyes and lots of tears. Can you comment on that? And I guess particularly, I imagine Andy's wondering, what can he do about that?
Yeah, absolutely. So it is a very common and slightly unintuitive thing that dry eyes can often quite manifest as watery eyes. And that's because the quality of the tears is not ideal. And so they're not staying on the surface in the way that you would like to provide that comfort. And so there are a variety of different factors. We talked about one for simplicity here that's quite related to Parkinson's disease, but the variety of factors that influence dry eyes. And so I'd really recommend in this scenario going along to see your optometrist, and they'll be able to appropriately manage that particular type of dry eye that you might be experiencing.
That's really interesting. I didn't know that, Christine. So are you saying almost that the tears become a bit less oily, a bit less viscous, so they're just not sticking on the eye? Have I got the right idea there?
Yeah, that can certainly be a component that causes that wateriness as well.
Okay, well, maybe I'll just jump in with the next question. Thank you for your question, Booth, who's asking, what medication do you recommend for dry eyes? And I appreciate you can't give individual recommendations, but just speaking in general terms, could you give a few pointers to our listeners?
Yeah, so generally, there are a large variety of medications out there, as you can see when you go to your pharmacy. Many of them are off the shelf when we're talking about dry eye medications. And so my recommendation, if you're, feeling dry eyes and you're having to instill them quite regularly, is to choose something that doesn't have a preservative in it, because that enables you to keep that watering the plants approach that we discussed before and being preemptive. So there are a variety of them out there if you go to your pharmacy, and a lot of them are good.
Michelle, would you like to do a few of the questions?
Yeah, we had a couple actually prior to here. So Ron says that his wife has had Parkinson's for 20 years, and she came home from hospital and had trouble keeping her eyes open. Sometimes they're open for quite a while, other times she struggles to open them. Do you have any ideas? And that might be either Christine or Jane with that one.
I was going to say this might be a collaborative care approach, this particular question. But as Jane mentioned, it is a little bit tricky to give very accurate individualized advice. But one potential hypothesis is that it may be a difficulty of the eyes to open, which is called apraxia of lid opening. And this is one of the scenarios where your optometrist, whether they be a neuro optometrist or a general optometrist, might refer you to a neuro ophthalmologist, and perhaps do neurology manage in this field as well, or would your preference be?
Yeah, we would. It's quite common actually that I see this in people with Parkinson's. So the two things that I wonder about is there's something called blepharospasm, which is where any of us can get this with or without Parkinson's, but people with Parkinson's are a bit more commonly. So this is where the muscles around the outer eye, they start to spasm when they should be relaxed. Sometimes it can be triggered by bright lights or stress or tiredness. Sometimes it just occurs randomly. And if we see that, when you look at your wife, you might see that the eyes look screwed up, so all the muscles look very active. We can actually treat that with a little bit of Botox just to relax the muscles. But as Christine said, the other thing that we do see is something called eyelid opening apraxia, which actually is more of a brain issue where the messages from the brain are not getting to the eyelids to trigger that opening. Normally with that, you don't see that scrunched up eye. It just looks like the eye is nice and relaxed. And one thing you can try is to say to your wife, or you even do it, Ron, just lifting up the eyelid. Sometimes it's all it takes to then keep the eyes open. It's almost like it's just that very beginning part, that initiation. which, as you probably have worked out, that's often a bit of an issue with Parkinson's, initiating movement. So sometimes people will be sat in a chair. When they stand up, they find it quite difficult, that first step. But once they've done that, they're fine. And it's a bit similar with the eyelids. So those are two things that we do see, and we normally could improve as well.
So interesting. Great. And Marion Coleman said that you can find an optometrist she's put the website in there, Good Vision for Life, and you can even select neuro-optometry to search. So thanks for that tip, Marianne.
She's a great colleague, by the way.
She is great, yes.
She's wonderful. If you're interested in dementia and vision research. Yes. Thank you, Marianne.
I was just going to say, I love the interactive nature where people are adding in their own tips. This is brilliant.
Crowdsourcing.
May I ask another question that was emailed in before? So people can email questions in. And this is from somebody who says, I have Parkinson's, mainly down one side of my body, which is very common because we know Parkinson's tends to affect one side more than the other. And she's saying that she's noticed her eyes have really deteriorated quickly over the last 12 months, and cataracts have started to develop over the last few years. She's had 2 eye tests in the last year. And a week ago, it showed that there's been a deterioration in sharpness, as well as the cataract has grown more on one side more than the other. And she's saying, really, could these visual changes, the cataracts, the sharpness, be a direct result of Parkinson's?
Yeah, that's a good question. So cataracts is one of those things that does increase as we count our birthday candles, and it can present asymmetrically. It can present in one eye more than the other. There hasn't yet been proven to be a direct link between cataracts and Parkinson's disease. However, as mentioned earlier in the talk, if you do have Parkinson's disease and you do have cataracts as well, it is one of those scenarios where we'd probably recommend looking into cataract surgery a little bit earlier rather than later, because what that does is that minimizes the change in your vision before and after cataracts. And by doing that, we know that that decreases your chance of having falls. Yeah, so that would be my advice in that space.
Great. Well, I've spotted, Michelle, I think we have about 10 more questions in about 10 minutes. So now we're going to move into quick fire mode. No pressure.
Dating questions.
We don't disappoint our attendees. We'll
No
alternate.
worries.
All right, I'll go first. Christine, does eyesight go or become an issue early in the onset of Parkinson's?
So we know that many changes occur in the eyes actually before Parkinson's disease is diagnosed, but we can pick these up because we have sophisticated technology. It tends not to be that there are marked vision changes that people really notice on a day-to-day basis that preempts their Parkinson's disease. So it's more to do with the tools than the symptoms. Hopefully that was fast enough.
My go. How far are we from using eye tests to diagnose Parkinson's?
Yeah, so that's something that we're working very hard towards, our groups and others around the world, because of that capacity and infrastructure that's out there already to be able to leverage. We're not yet there yet, but we're going to certainly keep on trying because we know that that's a space that needs a lot more help.
This is a fabulous science question. I have to say, I don't know the answer. See if you do, Christine. You mentioned visual hallucinations might be a side effect of Parkinsonian drugs, particularly the dopa. Do you find any of the retinal cells, so bipolar cells, amacrine cells, etc., rely on dopamine extensively as a neurotransmitter? And I know there's lots of convergence, but I'm really curious to know more about if this is a direct impact. I'm curious now as well.
Yeah, it absolutely, definitely has a role in the retina, dopamine. It is encapsulated, or it is released by a subtype of the amacrine cells, given that's a very scientific question, and it acts on a range of different cells through the retina. And we know that when we give people with Parkinson's their levodopa dose, then that brings back some of the functioning of those cells, the photoreceptors and bipolar cells. And so it very much speaks directly to your question there.
So
Great question.
Yeah. Do you have any idea of the proportion of people with Parkinson's that have or develop optical issues that are related to Parkinson's? I guess that's a hard one, but
it is
yeah.
true, and it kind of depends which symptoms as well. There is that wide variety. We know that with the colour vision, that for example, with REM sleep behaviour disorder, that a very large percentage of individuals have colour vision changes, as well as with the eye scans, there's a large percentage, but it very much varies depending on the particular symptom. As you saw, some are kind of 1 in 5 to 1 in 2 on some of the different things that we spoke about in the slides.
So super common, and certainly in my clinics, neurology clinics, we do spend quite a bit of time talking about eyes and eye symptoms. So, this is a great comment from Jane that she wasn't aware until recently that dry eyes are a symptom of Parkinson's. So it might be people have an eye symptom, just haven't grouped it together with Parkinson's. But Jane says dry eyes are driving her crazy. Can you tell her if this symptom appears early in the Parkinson's journey, late, or is it just at any time? Great question.
Yeah, great question. And you've kind of hit it at the back of your question there, Jane, in that it can very much happen at any time. And it can also happen without Parkinson's as well, which is sometimes why it's difficult to link that. For example, the dry eyes are associated with the Parkinson's disease. But yes, it could happen at any time. But the key is to go and see your local friendly eye care practitioner, and they'll help you out with what sounds like it's very irritating for you at the moment.
Right, we've got another one from Adam. So he wants to know about colour testing this time. So is this more due to midbrain impacts, LGN, I'm hoping you know what that means, or cortical impacts, V1 to V5, or related to vision on the receptors? Curious because I'm looking into visual cognitive testing, but I refer to a neuro-optometrist for retinal testing.
Wonderful. So a very sharp question once again, Adam. And the short answer is it hasn't clearly been defined where along the visual pathway, whether it's at the lateral geniculate nucleus, which is the LGN, or higher up, or at the retina. They don't know exactly what along the pathway is the locus of the colour vision deficit, because as you know, it can occur anywhere. And so further research is certainly required in that space, but they don't know for sure just yet.
That's a great question though, isn't it? So is it coming from the eye or is it coming from the brain? I guess that's a good summary way of asking that question. Adam, you sound very knowledgeable, and I think you should be on this webinar next time. So let us know.
I'll ask you some questions next, Adam.
Ian's asking a good question. He's saying that he's got issues with keeping his eyes open, especially when in the shower or going for a swim. Do you have any thoughts on that? Any tips for how we can help Ian?
So I'll leave that one to you, Jane.
Yeah, I mean, it's always hard, Ian, without having a look at somebody to say why that might be. Going back to my previous point, we do know that people with Parkinson's are a bit more prone to blepharospasm. So that's where you will see actually spasm of the muscles around the eye. Sometimes that's more likely to occur if the medications are wearing off. And so, you know, trying to time the medications for when you're having a swim or a shower might help. Or even talking to your doctor about you maybe need just a little bit more of the medications. But as mentioned before, if it is blepharospasm, we know that things like cold air, bright lights, water, and so on sometimes trigger it, whereas the rest of the time you're absolutely fine. But sometimes I say that combination of a low dose of your medication and the trigger is just enough to trigger the spasm. So we try and improve one of those. It's really hard though to say without having a look. And I would say talk to your doctor. And if it is occurring, the other top tip is try, you know, a bit hard when you're in the shower or swim, but if you can, try and get a little selfie video with your mobile, because I know what it's like when you go to the doctor, there's nothing to see. So if you can try and video it in between appointments, that really helps your doctor work out what might be going on. I hope that helps.
Excellent. So we've got 3 minutes and 2 questions. So Charles says, I suffer from dry eye and seem to do an excessive amount of squinting and can't seem to warm up the eye. Is that part of the dry eye, or is there something else that can be done, or is that something else?
Again, a little bit of a tricky one to answer without being able to see you face to face. It is possible that when, you know, your eyes are dry and irritated, you may squint a little bit more. And the idea behind that is, of course, when you have your eyes closed, it tends to be a little bit more comfortable because that evaporation is decreasing. In terms of warming up the eye, I guess if it's sometimes it all as part of the treatment for dry eye, if it has to do with the presence of the oily tear film on top that keeps the hydration in. And sometimes what we do is we recommend warm compresses. And so that can help with your dry eye as well, if I've understood your question correctly. But I know I probably sound like a broken record, but once again, I would genuinely recommend going to see your eye care professional, and they'll be able to advise you in a more personalised manner.
And just jumping into that, Christine, when people go to places like Specsavers and high street optometrists, can they get an idea of how oily that film is? Can they, you know, see the composition, if you will, of the tears?
Absolutely, absolutely. They can do a comprehensive dry eye workup at whether you're going to a corporate store or a private store or down your high street. All your local optometrists will be able to do that for you.
Brilliant. Well, 2 questions, 1 minute. Is there a link between Parkinson's and sudden onset cataracts? Felicity's husband is 60 with Parkinson's and had this earlier in the year, and he had none of the other known causes. What's your thoughts on that? Coincidence or connected?
The current evidence at the moment doesn't indicate that there's a strong link between sudden onset cataracts and Parkinson's disease. There are other links between sudden onset cataracts, things like steroid use and other interventions, but there's not a strong link just between Parkinson's and cataracts at the moment. Having said that, as mentioned, if you are experiencing these, then looking into getting cataract surgery earlier rather than later may be helpful.
Great. Well, we're right on 2 o'clock. Someone has asked whether there'll be a recording saved. So this will be put up on our website with Christine's permission, of course. Yep, great. So we will definitely do that. So I guess thank you so much, Christine. That was such a wonderful presentation, and thank you so much for answering all those questions as well. It was so interesting. I think we've got maybe just someone saying basically that they once they stopped taking the drugs, then the dry eyes disappeared. So that was interesting connection.
Although I don't think we can leave Chanika's comment unanswered. I think that's a very humorous way to end, which is should have gone to Specsavers. You're absolutely right. We don't have shares or any links with Specsavers as such. But I think that is a take-home message. If you're concerned about your eyes, please do go and get them checked. There's so much that can be done to help, and without those checks, it really impacts people's quality of life. So I think this is a positive story, and I would encourage everybody to go to the optometrist or raise your concerns with your Parkinson's specialist. Christine, I would just like to echo Michelle's thanks. It's been fabulous to have you on the Tasmania Parkinson's Project webinar this month. So we hope to have you back in the future. You can tell us more about your research. And we're getting lots and lots of thanks here from all our attendees. If somebody did miss it and you want to come back and look at a particular slide or scan that QR code for Christine's research, just give us a day or so, and this webinar will be recorded and up on the Tasmania Parkinson's Project website. And you've just got to look for a little tab that says educational webinars, and it will be there. Christine, we leave the final words to you before we end the webinar for all our lovely attendees.
I think you summarised it very nicely, Jane, that if you do have any concerns or queries, then do go and see your local eye care practitioner and your neurologist, and then that will be the best way to help to give you personalised treatments. And thank you so much for having me. I've really enjoyed it, and I look forward to seeing the other webinars that come up across the Tasmanian Parkinson's Project.
Thank you, and thank you for joining us, everybody. We'll see you again in a month. Bye-bye.